So we help organizations by the fact that more often than not, clinical information is living across multiple different clinical systems. So we've got information living in primary care, we've got information living in long-term care, we have information living in the acute space, health information exchanges, pharmacy, and so forth. And by a product of how we've developed and designed systems, they live each in individual silos. What we've designed with Health Data Intelligence is to create one longitudinal record across all of those different environments so that we're able to have a full, complete picture of everything that's happened for a patient at any given point in time, regardless of where that patient presents across the care continuum, to help those clinicians pinpoint exactly what it is that we should be doing for those patients the next time they present somewhere else across the healthcare ecosystem. So we have created unified views of clinical data across multiple different systems with Health Data Intelligence by data acquisition. We'll actually go directly to the source of information, onboard it on behalf of our clients as an as-a-service model to do the cleansing, normalization, reconciliation of all data across those disparate systems so that we are able to then unify that data, create that one single longitudinal record for use in clinical applications all the way down to the individual patient viewing information on themselves as well. So a number of organizations around the world have used Health Data Intelligence to onboard the data that we mentioned living in disparate environments to then go create key performance indicators and analytical views of where their information exists, helping them pinpoint where there are opportunities for improvement, either at the patient level all the way down into the individual patient or at the macro level, at the population level, to see where there are trends and patterns that can be adjusted, shifted, understanding what the other barriers outside of that clinical information might be to preventing those patients from becoming healthier, coming into the system in a much more organized manner as opposed to waiting for those individuals to wind up in the emergency department from something that we knew was ailing them or perplexing them in the community space already. Allowing for organizations to be much more innovative, to be more strategic, be more advanced and proactive in managing that patient population, again, in advance of allowing for those patients to walk through from an emergency perspective for things that we could have solved for in the community space in a much more cost-effective manner in the community space. So what I've seen, not only across Canada, but broadly across the globe in the various different regions I've worked for the last 15 years with Oracle Health, has been a lack of regulatory requirements and actually allowing for data sharing, as well as a funding model to go do that. A lot of times organizations are looking for a carrot or stick model where that may not be present at that time. So in the US, they've created models of care around accountable care organizations to go create incentive for not only data sharing, but also improvement of care for those individuals. We haven't really seen that in the Canadian market. We've seen some organizations kind of tip their toe in that water in the UK space and some of the other global regions, but thus far there hasn't been an incentive to have those data sets come together, while there is a concept of working together in a team collaborative fashion. Very similar with like in Ontario health teams or OHTs here in the Ontario market. The goal and strategy is there. The healthcare organizations have the desire to go support patients in a more meaningful way. It just doesn't seem like there's been a regulatory kind of push to go undertake some of those things. Having had the opportunity to speak last year and again this year was really kind of awesome to see the trajectory and the change in how organizations are buying. So in the last 12 months, we've seen a number of different organizations come to market since the last infrastructure conference. And I would say that they're focusing beyond just the health information system that we historically have seen organizations from a buying perspective focus around, to being much more focused around integrating care and creating population health management and looking outside just the four walls of the population that they're responsible for. And it's been really enlightening to me to see that Canada is starting to adopt some of the future direction and where things could go and support the patient in the community space.